We are live. We are live. I'm Dr. Frita. Welcome to Dr. Frita Live, where we discuss the latest trending medical headlines and celebrity health news. As usual, we have a jam-packed show for you today with evidence-based medical information. We're going to start off talking about Hayden Panettiere, and we talked about her a little bit last week when we first learned that she sadly passed away at the age of 36. A beautiful, talented actor. Remember the Titans, Heroes, Nashville, and she just wrote a memoir, and she'd been on the circuit talking about it, being very vulnerable and transparent about substance use disorders that she had, grief, including postpartum depression. And now, as of August 16th, she was found to be unresponsive. There were a couple of people with her, someone who was, at least in the past, her romantic interest, and he had gone to jail for domestic violence. We'll get into that. At any rate, the coroner initially said that it was from cardiac arrest. As of now, the cause and manner of death have not been revealed. They're not determined to our knowledge as of now, but we will talk about her grief, her history of substance, postpartum. And so we'll talk about Hayden Panettiere as we celebrate her life and her talent. And then we will talk about Paris Jackson. Yes, Paris Jackson, the Michael Jackson's daughter. She has been very transparent about her history of substance use disorder and just loneliness, chronic loneliness. And so we'll talk about Paris Jackson and her mental health struggles that she has now come to the front and shared. And then we'll talk about something that is actually quite tragic. We have a woman who went in for a knee replacement. Okay, how many people have arthritis and get knee replacements? But instead of just getting this routine, relatively safe procedure, she came out being paralyzed from the chest down because of a medical mistake. Okay, so we'll talk about the medical mistake, and more importantly, even we'll talk about how to advocate for yourself when you are the patient and when you're entrusting your lives with the doctors. All right. And then we have more tragic news. Michael Wright, star of The Five Heartbeats, has passed away at the age of 70. We'll talk about the rare neurological condition as well as a heart condition. And we, of course, will take the sadness and what happened to him in order for us to learn, right, to live our healthiest, happiest lives. And then we'll close this day out with our game, Myth versus Fact, because the drummer of Earth, Wind, and Fire, actually, John Paris, had a cardiac event and had quite the interesting post-cardiac event treatment. And so it's something that's been around for years, but a lot of people don't know about it. And so we'll talk about it. Of course, we are live. I am Dr. Frita. So you can ask me questions, but guess what? I'm asking you questions too. So make sure you give us a like and a subscribe and a share as we get started, because I am guaranteed to give you evidence-based medical information. Let's get started. This is Dr. Frita Live. Hello, hello. I'm Dr. Frita. Welcome. This is Dr. Frita Live. We're about to go ahead and get started. Please make sure you give us a like and share this video. I'm very proud to say that we have over 1 million subscribers. Thank y'all right here on the Dr. Frita Live channel. And we have those subscribers, I suspect, because we give evidence-based medical information in a way that's easy to understand, in a way that will help you to enhance your life. And so thank you for joining. If you caught us here, if you're not subscribed, let me tell you, go ahead and subscribe. We have a good time here. I give you valuable information that you can share with loved ones. And so let's go ahead and get this day started. You know I'm not starting this thing alone. To my office manager and co-host, Ms. Shador, please come to the front of the stage. How you doing, Miss Shador?
Good, Dr. Frida. How are you? Hi, Medheads.
Oh, goodness. Hey, Medheads. I hope everyone had a good weekend. How was your weekend, Shador?
Weekend was okay. No complaints over here. Did some new hairstyles for my nieces and did some cleaning. So, yep.
And
How was yours?
it was good. Shador, you are very talented. Like, you be so understated with the stuff you can do. You have like a million talents. Like, you literally can do designs in hair, perfect parts, all that kind of stuff. Listen, my kids used to be doing well to get an Afro puff or two, and while I tried to preserve their edges.
Oh, gosh.
just pray for the people. But our weekend was busy. Avery, my youngest daughter, my 15-year-old, my little basketball player, was invited to that CP3 camp. And so she did
Yes.
that this weekend in North Carolina, and jam-packed with all kinds of drills. They had like 60 coaches, they had media there, a lot of learning, seminars, like even a nutrition seminar, which she
Mm.
found to be helpful, and just a lot of practical, good advice for the athletes. And so I enjoyed the speakers, enjoyed being there. Shout out to Coach BT, Coach Mo, and to some of the other people. Lisa Leslie was there. And listen, I'd be acting like I can't have C, but I was like, "Is that Lisa Leslie? She's so beautiful. She's so beautiful." And she like having this nice flowing dress, just so feminine and neat and model-esque. And just it was fun. It was a good weekend and busy, but I feel like Avery learned a lot. I don't want her to pressure herself too much. And I know I don't think I put too much pressure on her. I just want her to have fun. But it's a lot, and I felt short for probably the first time. Okay. And listen, med
Thank
heads,
God for all.
folks I'm 5'11". But when I tell you I was like not even close to being tall, the boys who were there, like the little 15-year-olds, were 6'8", 6'10". At 6'2", you were kind of short if you were a guy there, right? And those guys came from somewhere, and I saw where from the mamas who were 6'4", 6'3". I was putting my shoulders back and stretching my neck up. I never felt
Thank
short
God how I
before.
feel.
It was crazy. I was walking behind people like kind of at their shoulders and below. That's not the life I live. I'm usually my head is above. So I think this gives me more empathy for folks who are vertically challenged. Anyway, all right. Shador, who was the first med head in the chat?
First in the chat. Remember Miss Sheila. Hello.
Hey, Miss Sheila. All right, be ready. Be ready. We got a lot of questions, Miss Sheila.
Absolutely. And shout out to our other med heads or members, Miss Grace. Hello.
Hello, Miss Grace. Thank you for being a member. Thank you to the med heads.
The caller as always.
Hey, Dakala. Be ready, Dakala.
Miss Rachel. Hey.
Hi, Miss Rachel.
And Miss Rosalind. Been a while. Hey,
Day
Miss
one.
Rosalind.
Hey, Miss Roslyn. Excellent, excellent. Wait, is this the last Monday of the month?
Ooh. I think it is the last Monday of the month.
It sure
Oh,
is.
check my calendar.
If so, we have our live Q&A last Monday of the month.
No,
Listen,
we have one
members,
more. Next Monday, Dr. Freedom. Next Monday,
Monday.
31st.
Oh, look, I was about to move these things up. Okay, so on the 31st. Oh, the actual 31st is the last Monday. Okay, we do our
31st.
members only live Q&A on the 31st. I was about to mess the thing up. So everyone, thank you to everyone for being here. Again, make sure you give us a like and a subscribe and a follow. It's a free way to support the channel. And I appreciate our members. For our membership, we have members only videos, and of course for the highest tier of membership, if you are a chief resident, we do a members only live Q&A on the last Monday of every month, which is next Monday, where you can come and ask me whatever you'd like to ask me. And for those of you who are new to me, I am Dr. Frita. I'm an MD. I'm a medical doctor. I have been quadruple board certified. I am a board certified nephrologist. So I'm board certified as a kidney doctor and a high blood pressure doctor. I am also board certified in internal medicine. I am also board certified in obesity medicine. After I completed my dual internal medicine pediatrics residency at Georgetown University Hospital, I earned a board certification in pediatrics as well. So I love to learn medicine. I love to talk a lot about medicine. Most importantly, I enjoy sharing what I learn with you to help you to understand medicine better so that you can advocate for yourself and for your loved ones. And so, in case you go to the doctor and you feel a little intimidated, overwhelmed, like you don't know and they know it, listen, I have hundreds of videos that will really give you some very good knowledge. So when you go into your doctor, you'll know what's expected. You know the standard of care. You'll know the questions to ask. And the squeaky wheel gets the oil. And so it will help to make sure to close that health disparity gap, or to make sure you don't feel like you're being talked down to or in a condescending manner. It'll give you a 1-up, I'm telling you. So make sure if you haven't already subscribed or started watching my videos that you do. Also, I enjoy spreading medicine on the media. If after we finish this live, you check on my television playlist, on the playlist here, you'll see where I am a recurrent medical expert, having great conversations with Don Lemon, with Joy Reid, on News Nation, that national medical news show. You can go back when I would be on HLN. I've been on Paternity Court, The Griot. Oh my gosh. Revolt TV back in the day. Oh my goodness. Sister Circle Live. Oh my gosh. Just listen, all types of media medicine I do. Very recently, 11 to Live NBC had a great conversation with Aisha Howard talking about food outbreaks, CBS News, also our Channel 2 local ABC News. In other words, I spread the word, not just to my good old med heads here, but I tell the world, oh, tell it on the mountain. Anyway, y'all, just make sure you give us a like, share this in your group, me, your WhatsApp. It really does help us. And again, I appreciate y'all for being here, all of you for being here. Appreciate you in the replay crew. I see you. And I thank you for helping us to get to the over 1 million subscribers we have, and we're still growing. All right. Well, the first story we'll talk about is one that is pretty sad. It's Hayden Panettiere, and she's the beautiful young, very talented actor. Remember the Titans, Heroes, Nashville, and she was very open. Had written a memoir that she was talking about, saying that she had, alcohol overuse disorder, substance use disorder, that she was dealing with grief, depression, anxiety, agoraphobia. She had lost her brother. She had an 11-year-old daughter who, at least, at the time was under the guardianship of her father. It sounded like they had a pretty good and improving relationship. Her relationship with her mother was not the best. And we can talk about her mother's remarks since Hayden's passing away. But let's go ahead and let's play this clip. In MedHeads, what I want you to put in your emojis, I want you to give me what I want to go in the emoji for Hayden. Just give me a lovely little heart. Just my heart is full for her. Just give me a red heart and answer these questions. What do you think are some of the warning signs that someone might be drinking alcohol, not just to be social, but actually be drinking it to cope? And also, what do you think some warning signs of postpartum depression might be? And then we'll get into those. So warning signs of postpartum depression, warning signs that someone is drinking and it might be a bit much. Okay. And these questions are going to hold for both Hayden and for Paris Jackson that we'll get into. Let's play the clip for Hayden and then let's talk about it.
This morning, we're learning new details in the shocking death of star actress Hayden Panettiere.
Cardiac arrest of Milwaukee, 701 East Liberty Road.
Audio captures first responders rushing to the apartment complex where the 36-year-old was found unresponsive Sunday.
CPR is in progress.
There were a bunch of people in the halls, frantic, and I had heard something about a collapse.
On Monday, the coroner's office completed an autopsy saying the cause of death is still pending, but no signs of trauma were discovered that would have contributed to the death. And the Greenville Police Department says their preliminary investigation did not produce evidence of foul play or suspicious circumstance. Fans and neighbors gathering near the apartment where Hayden was staying, a growing memorial honoring the late actress. She grew up in front of the camera, appearing in Remember the Titans at just 10 years old.
Morning.
Where's your dad?
He's in his office.
And an ice princess alongside Michelle Trachtenberg, who passed away earlier this year.
You're a slut, Casey. If I drop out, you're ranked next.
Panettiere leaves behind her 11-year-old daughter, Kaya. Overnight, her ex-fiance and the father of their child, Vladimir Klitschko, speaking out saying, "Nothing will erase the times we shared or the place she had in our lives. To our daughter, Kaya, I will always speak of her mother with respect and make sure she remembers the person she was."
Oh my goodness. Oh, I don't know why that makes me so emotional because, we see these child actors and we're so impressed with them. They're so precocious, they're so mature, so talented, and they're like little adults in their interviews. And we laugh and we say, oh my gosh, oh, that's such a little old lady. But then you think about the pressure that it takes, right? To be that young and to have to be such an adult, so to speak, to be able to answer questions, to mingle, to have these schedules where quite frankly, they don't really, oftentimes it sounds like in Hollywood, allow you to be a child, allow you to be like, oh, I'm tired, or allow you to be like, I don't wanna. You have to go and be a perfectionist. And Hayden shared, I know in some of her interviews, at least one, that in order to get tears on the spot, as actors and do, she would have to go to a deep place of emotion. For example, when a pet passed away, and she had to be able to access that emotion very quickly to get to those tears. And she even shared that sometimes it became difficult for her to know where her character ended and where she began, Now imagine, she's actually been acting since before she was 1 year old, if you can believe it, her entire life. And she shares in her memoir, just, different abuse, quite frankly, that she went through, her strained relationship with her mother, her momager. And I like the statement that her ex-fiance, her child's father, made about her. And I love that he said he's always going to speak to his daughter about his mother with respect. Okay. So even with the things that she shared about herself, the addictions and the grief and the postpartum, he's always going to talk about her with respect. And that really moves me. And it's a contrast because Hayden's mother actually came out, and it takes Gail King, because she kind of went off about that response. You could tell she didn't appreciate it, but the mom was basically saying, Hayden lost her way, and had she not lost her way, maybe things would get better. I'm paraphrasing, but it sounded like the mom was blaming the victim. At any rate, currently we don't know the official cause of her passing away. Initially, even from the official 911 dispatchers, people have been, using the term overdose. We don't know. The toxicology has not come back. It has been reported that her, at least, ex-boyfriend, I don't know if he was a current one, Brian, who had gone to jail for domestic violence, which he even has come out and talked about it to TMZ, reportedly, about the domestic violence, saying, "Oh, I was drunk when I did it." At any rate, he and his brother were there with Hayden, reportedly, when she passed. There's been a bag of pills that's redacted to my knowledge, so we don't know what medicine she was on, but he shared that. And at least from the Greenville County coroner's initial report, there were no signs of overt foul play. We don't know, again, the official cause and manner of death, but she had cardiac arrest. And make sure after you finish watching this live, I just posted on some other social media platforms. Follow me on all platforms. Cardiac arrest versus heart attack. There's a difference, but I've had people asking me the questions. Okay, cardiac arrest versus heart attack. It's been reported that she has a cardiac arrest, and once we find the final, I'll come back and talk about that. Now, let's talk about what we do know from Hayden's mouth: the substance use and the postpartum depression. Okay. Hayden shared that she, after she had her 11-year-old child, dealt with postpartum depression. And we hear that term thrown about a bit. And so I think we sometimes lose just how serious it really is. Postpartum depression. So it's rather common for women to get postpartum blues, they say, right after you have a baby, or even while you're pregnant, peripartum blues or peripartum depression. But for the postpartum blues, that has a limited time. It can happen right after you birth your child, and it doesn't last more than a week or two. And we're talking about some sadness, some tearfulness, maybe some change in appetite, some classic symptoms of depression. Nothing that you're not trying to harm your child or having delusions or confusion or hallucinations, just some sadness. And the key with postpartum blues is that by the end of week 2, you're better. Okay. Now, if these symptoms continue or even worsen, and you're dealing with these symptoms of depression for months, well, now we're getting into postpartum depression, where you're having difficulty finding pleasure, where you are not motivated necessarily to bathe, to clean, where you're just having an overwhelming sadness. You can have change in eating habits, change in sleeping habits. And certainly if you're having this and it's gone beyond those 2 weeks, you want to consult with your doctor. Yes, your OBGYN, also your primary care and mental health care professionals, okay? Because postpartum depression is real, and that's what she described, Hayden did. And then there's also something called postpartum psychosis that can happen like even in that first week, and that's where there can be confusion and thoughts of a mother hurting herself or even hurting her child. Now that's an emergency. If you notice that in someone, you need to call 911. Or if you're the mother who's experiencing it, please don't play around. Please don't be embarrassed. These things happen. The postpartum depression can happen. And then with Hayden's substance use, of course, another thing that we actually know about, because she shared opioids reportedly, as well as alcohol. She said she'll wake up and that would be the first thing that she thought about, alcohol. And it just makes me pretty sad, because she was in Hollywood. She pretty much dedicated her life so that we would be entertained. And, she was even in Bring It On, like the 2006 version. And to know that she was suffering, so much. She even talked about the men, like these much older men, like when she was 18. I won't get into all the stories, but she had a troubled life, and it felt like she was just coming to the front when she was sharing her book. I know part of the title of it was The Reckoning. It felt like she was making a turnaround, and then for her to be gone. But I'll be back to share what her specific cause, cause and manner of passing away were. But for now, I want to hear from you, med heads. And let's see. You know what, Shadora, let's put up the link, and we'll just take one or two people for the link. If you want to come and share on the stage, we don't need to have your face up here. You must enable your camera and the microphone, but as soon as you do that, you can turn the camera off, and it'll be a listening. And also, we'll look in the chat to see what you think some warning signs might be as far as the substance use and postpartum depression, just so we're watching and paying attention, right? Okay.
Yeah. So the link has been shared, everyone.
Okay. And if you hop on stage with the link, then you will get priority. But meanwhile, we'll look in the chat and see what y'all have to say.
All right. Miss Sheila says her mental health.
Her mental
would
health
be the cause to the drinking and things of that nature.
definitely. And I don't know as far as her official diagnoses outside of what she shared with the postpartum depression, alcohol overuse, opioid use. But I'll tell you, Miss Sheila, that's also, it can be, it can increase your risk for having postpartum depression. If you already are having depression, substance use prior to getting pregnant, that will increase your risk there. Yeah.
All right. Miss Susie had a couple of comments about, I guess, how you know someone is drinking or have alcohol abuse. She says drinking first thing in the morning,
Okay.
empty bottles around the home,
Okay.
being aggressive and isolated.
Those are very good. Those are very good. And it makes me think about a tool that we as physicians and healthcare providers use. And there are different forms of this tool, but CAGE, CAGE, is when you're asking someone if they have, and y'all can look it up, CAGE, CAGE, for people to kind of try to think if they might have an alcohol overuse disorder. And just some of the things in there, like for that A, are you annoyed if people are asking you, oh, you're on your second drink, oh, that's a fourth, or you having a little bit? Do you really get annoyed? And are a lot of people asking you about your drinking? And then for that G, do you feel guilt, right? Like, do you drink and then you're just like, dang, I said I was going to cut back and now I drank again last night. I really shouldn't have done that. Is that guilt something that's frequent? And then what you mentioned as far as waking up in the morning, the E, the eye opener. Okay. The eye opener. Other things, have you tried to quit, and been unsuccessful? And so there's different levels to alcohol overuse disorder, and it also depends. Like if you grew up in a family where no one drank at all, and then you have yourself a little piece of wine at the cookout, then you might have your aunties who are clutching the pearls. Oh, you're an alcoholic. Not necessarily, but if you think about some of these items that you just shared, it's at least something to think about and to talk to your healthcare provider. Also, know your labs, know your liver function tests, things of that nature. But just because you have normal liver function does not mean that you don't have an alcohol overuse disorder. Okay, good. We'll take a couple more.
Yeah, we have a call in, Dr. Freedom from
Well,
Marina.
that call in jumps to the front of the line. Come on. Hello, welcome.
But just because you have normal liver function.
Hello. Can you hear me?
Yeah, we have a call in, Dr. Freedom from Marina.
Hi, you're on the stage.
Come on.
Hi, can you hear me?
Yes, I hear you well.
Yes, can you hear me?
Yes,
You hear me?
Oh, let me see. What do I need to do?
I hear you. Yes.
Hello?
I hear you. You're on the stage right now. You're saying hello.
Hello?
Hello. Oh, she might have to drop down if she doesn't hear us. Okay, well, thank you for trying to come to the stage. If you're able to maybe pop out and pop back, we'll
Hey,
have you
Marina,
back.
try, maybe, I think she's in an echo, so maybe turn off your other device, but we can definitely hear you. If you want to, I'll bring you back up shortly while she works that out. Dr. Frida,
Yeah.
Miss B Wellness.
Hi, Miss B Wellness.
She says withdrawn. They want to be alone. They have no
That's right.
plans to be around people. They do not have a desire for things they had a passion for.
Yes, and that can go with postpartum depression. That can go with major depression also. Yes, very good.
All right.
All right.
Let's try Marina back and see if she's able to hear us.
Okay. Hello, can you hear me? You're on the stage. Okay.
All
That's
right.
okay. Well, thank you for trying to come to the stage. So we'll drop her off. That way we'll know that she wants to come back. She can. We did hear you though. So if you come on back, we'll try that again when we open back up for questions. All right. So let's move on to do we have a clip for Paris Jackson?
Yes, we do.
Let's play hers, and then we'll keep those questions going out. We'll come back and ask more questions about how do you know if someone's having depression and yeah.
Or he obviously knew what it was from because that only happens from, cocaine, ketamine, just snorting drugs. And he was like, we can fix this, but if you keep going, it's just going to happen again. So if you're not done, I wouldn't bother yet. And I remember having the thought of, well, I'm not done.
You were sent to one of the centers in Utah.
There was definitely a lot of psychological, emotional, spiritual abuse that happened there. I definitely left with more PTSD than I went in there with.
Was there a time when you felt like you really let people down?
Oh, yeah. I mean, yeah.
Was there anyone that you felt like you really let down?
My younger self. More than anyone. I blew.
It makes me very sad. Because we see people, we know Michael Jackson, of course, iconic and Beat It and Thriller, and people used to just be fainting and just, it was unreal, during the era of Michael Jackson's fame and popularity. We didn't have all that Instagram and social media. He just was larger than life, quite frankly. And then when he had his children, including Paris Jackson, you're just like, oh my gosh, they've inherited the kingdom. Like their lives must be pretty perfect if you're looking at it from a material fame popularity standpoint. So to hear that Paris Jackson, Michael Jackson's daughter, has dealt with chronic loneliness as she shared and some pretty heavy substance use. I will say that she has been clean for 6 years, she reports. And so very proud of her for that. But the thing that she describes largely is chronic loneliness. Okay. And so that's different than just kind of feeling a little bit sad, feeling kind of by yourself, or like when there's an empty nest or things of that nature. That chronic loneliness, she describes that she would be in a room full of people and still feel alone. Okay. And of course there's a link there to depression. And so I definitely appreciate her for sharing her story. Very proud of her for her sobriety. And as we get ready to move, I'll see if there were any more in the chat from the previous discussion, which still, goes toward this as far as the substance and depression in general. Or, we'll do a going once, going twice to see if anyone else wants to come to that stage, to the stage again. Yeah.
So we do have some more comments. If anybody wants to join, the link is there. This is from Lynette. Hi, Lynette.
Hi.
She says constantly buying drinks.
Okay. Right. So there's a time where you might, I guess maybe someone might buy a drink or two, but if you're someone and you always have those drinks coming and you're really binging, and especially if it becomes a bit of a habit, yeah, that can be a sign that you have a problem and that the drinking is an overuse disorder as opposed to just a little social.
TT Aquarius, hello.
Hi.
Hiding alcohol in other drinking containers.
You don't want anyone else to know. So if it is a secret, you're hiding it in other containers, maybe taking it to work, maybe having it in the car, then that could be a big hint that you actually have alcohol overuse disorder. And so anyone who's listening, if this is describing you where you're hiding it, changing containers, I was looking at this one lady on Instagram. She's a mom, divorced now, and she actually had a liver transplant, and it was from alcohol overuse. And she said that she would put it in her nice little 32-ounce regular drinking container, something that looked like a Yeti. I'm not saying hers was a Yeti, but something, or maybe looked like a Stanley cup. It was that size. And she had her standard mix, and it was, I forget what it was, but it was all alcohol and then a splash of a creamer that she had. And it was all alcohol other than a little splash of creamer. And she would go through about 3 of those a day and ended up with liver failure. And so, but yes, it was not in a container that looked like alcohol. Oh dear. Okay. All right. So bottom line, once you're finished with this live, I want y'all to check out my video on the dark side of alcohol. where, we used to in the medical field say that there were, acceptable amounts of alcohol. And it was for a woman, 1 drink a day, for a man, 2 drinks a day. I didn't make the male versus female rules. And by 1 drink, we defined it as either like 5 ounces of wine, 12 ounces of a beer, or 1.5 ounces of like an 80 proof liquor. That's what was considered 1 drink. And so it was considered to be reasonable, moderate, 1 drink a day for men, or for women, 2 drinks a day for men. But now we actually say that even the tiniest amount of alcohol can be toxic. And so it's not anything that we're not recommending any alcohol. Does that mean that you have to all of a sudden run and quit? And that's the absolute that your doctor is going to say? No, but it does mean that even in the past, if you have been told, oh yeah, drink a glass of wine a day and that can help with heart disease, that's something that we were actually taught that, oh yeah, they should drink a glass of wine a day. Now, like with the American Heart Association, American College of Cardiology, we're no longer recommending any alcohol. Talk to your doctor about what could be reasonable for you, but certainly please keep in mind all the conversations we're having today about signs of having alcohol overuse, the hiding of the bottles, the feeling guilty when you wake up, having to have a drink first thing in the morning, feeling annoyed when people ask you about your drinking, having that guilt. All of those could be signs. And then certainly if you're not able to function, if you can't work, can't go to school. But there are a lot of people who have an alcohol overuse disorder who can function. So telling yourself, oh yeah, I function well, that's not enough. Okay. If you've had, DUIs before, that could be a hint as well. All right. But, sorry that we lost Hayden Panettiere. Very glad, with Paris Jackson and in her recovery. All right. Thank y'all. All right, now let's talk about something that is really quite the nightmare. A young woman in Nashville went to have a knee replacement. Okay, pretty routine, right? And she left being paralyzed from the chest down because of medical error. Let's go ahead and play this clip and then we'll talk about it on the other side. Make sure you give us a like, please. Give us a like.
Breaking news. Imagine going in for what is supposed to be routine surgery and being left permanently paralyzed.
Tonight, that is what several mid-state families are dealing with after procedures late last week at Ascension St. Thomas Hospital.
Investigative reporter Jennifer Krause is here with the very latest. Jen, this is terrifying. What happened?
Yeah, it definitely is. And heartbreaking and tragic. And the hospital is not providing a lot of details, but we have talked with one of those families as well as others. And here's what we can tell you. Last Friday, at least 4 people went to Ascension St. Thomas Midtown here in Nashville for joint replacement surgeries, and a drug mix-up led to things going horribly wrong in the operating room. I talked with the family of a Centerville woman who was there for a knee replacement. It was supposed to be outpatient surgery, but instead she has just learned that she is now permanently paralyzed from the chest down. I'm told she was supposed to have had an epidural for pain, but the wrong medication was injected, and she was not the only one. There are at least 3 others. The hospital told us in a statement, quote, "Our hearts are with the 4 patients and their families impacted by this event." The statement from the president and CEO of the hospital went on to say, on behalf of our leadership and care teams, "I am deeply sorry for the harm caused to our patients. We have met directly with each of the families to express our deep support, connected them with spiritual care teams, and ensured they have access to all appropriate resources and ongoing care needed."
There's nothing. Connected them with spiritual care teams. That is good. It does not allow someone who's going in to walk a little better because she just needed a knee replacement to walk a little better. Now she can't walk at all. And other people, atrocious and very frightening. So my question to you is this, and I want you to look. They have. Just give me a little hospital emoji. Okay, give me a little hospital emoji. Yes, they have those. Give me a hospital emoji, or you can give me a doctor or nurse emoji as well, and answer this question. What is a question, like an absolute safety question, that you do or will in the future make sure you ask an anesthesiologist or a surgeon or anyone who's about to administer medicine to you? What do you suggest? What's a good safety question to prevent something like this? And it's really sad because the onus should not be on the patients, right? What happened here was that instead of her getting the epidural with the numbing medicine that was going to, numb her below the waist so that she wouldn't feel the knee surgery, instead of that, they gave her a potassium injection that was not meant to be in the spine and caused her to be paralyzed just like that. It's very frustrating because, we're dealing in a society where there's already a lot of medical mistrust. And so now you go into a doctor to get a procedure done, not even a life-saving one, just one that helps with the quality of life. And now there she is paralyzed. I really hate that happened to her. But I'm curious, do we have any kind of doctor or hospital emojis where people have commented? What do you think is a safety question?
Yes, so not necessarily safety questions, but we do have some comments here.
Okay.
This is from member Miss Ebony. Hey, welcome
Hi.
in. She says, what happened to all the protocols with verifying patient ID and scanning the medications prescribed in the patient's chart?
Yeah, and I'd be curious where the error was, because it would be very difficult to believe that with 4 different patients, 4 different situations, that the mistake was on the verification. I'm wondering, and I don't know the answer to this, if the mistake happened further up, if there was a mislabeling. I don't know the answer. But even with that, you're right, because in the hospital, and I've mentioned it here, and even in the dialysis unit, I sit there and I sometimes get impatient when I'm waiting for a medication to be given or for a transfusion, and you got the 2 nurses. Show me the name on your wrist. Is this you? What is your date of birth? And then the 2 nurses are having the paper for the blood transfusion. They're going through all of these ID numbers and they're verifying, and they're going back and forth and back and forth. And it doesn't take a long time, but it definitely is a routine that they go through religiously before giving opioids, narcotics, blood transfusions, medications, verifying the patient, verifying the labels. And this is why, I definitely won't be sitting there impatient for sure. And I understood that there was always that protocol and the reason, but this is why. And so I don't know the answer to that question. What happened to the verification? What happened to the protocols? I do know this. Heads will roll. And I know there's really nothing that the CEO could do, because that CEO is probably somewhere sitting in Bali when this happened, but there has to be accountability. That lady will never walk again, and neither will 4 other people as well. I just hate that happened. Anyone else?
Yeah, TTL Aquarius and Zero along the same page. TTL Aquarius says, it sounds like the mix-up came from the drug manufacturer since it happened to more than one person.
That makes you wonder, right? And if it is the manufacturer, then the CEO won't be accountable. And I'm talking about accountability, but in the end, this lady's paralyzed, right? And that's the real thing that matters. But yeah, I'm on the same page with you. It feels like it came from somewhere in the beginning, and that's very frightening. Because then we're checking balances.
And that's what Zero is saying. She said, I heard that the actual vials were mislabeled to indicate that it was correct medication. So the error originated outside the hospital from the distributor. That's what she's hearing.
Okay, that would make more sense. I just can't see an anesthesiologist, haphazardly. Okay, let's just grab. If you've been in the room with them, for the safety of the patient and just for the integrity in your job, you don't really just get to be an anesthesiologist doing this every single day and be haphazard. Not that it's impossible, but okay. But I'm just really sorry about what happened to her. Like, I almost have no words. I always have words. But just to be someone, she probably just went back and forth deciding if she was even going to get the knee replacement. Because again, it's not an emergency, but it's like, okay, fine, let me do this to improve my walking. And now you can't walk.
Yeah. Okay. And then some questions that our med hits would ask.
Okay.
Do better, be better. Hi.
Oh, that's the name. Do better, be better. Look, that's the message to whoever made this error. Yeah.
Their question would be, what is your rate of error?
What is your rate of error?
Yes, that would be one of their questions too. I guess the
questions that you're going to ask. Okay, now I was like, you asking me what? Okay, so yeah, that is good. So before you even go in, what is your rate of error? And then just even making it broader. Okay, you do this procedure. What percentage of your patients end up walking well? What percentage of your patients need to come back for revisions? What percentage of your patients get infections? What percentage of your patients have been fallen victim to medication mismatches? That's a good question. Okay, good.
Remember the caller says, look up his or her credentials.
Looking up the credentials, that's open to everyone to be able to Google. Like to go to American Board of Internal Medicine, American Board of Obesity Medicine, the College of Cardiology. Yeah, you'll be able to see credentials. Very good.
And along with that, Miss B. Wilder says, how many procedures have they had or have they done?
Very good. That's very good, because you might have all the credentials and you might be, you completed your program, but you haven't done any this particular procedure. And I will say it does count even when you're in residency, fellowship, when you're assisting with the doctors and things of that nature towards your experience. But yeah, how many have you had? Yeah.
Remember, Ms. Rosalind.
My father, y'all know, is a retired surgeon, a retired general and peripheral vascular surgeon, and he was a general surgeon when it was the real deal. So I'm talking about he's done organ harvesting for transplants, autopsies, of course, AV fistulas. That was a big thing for him, doing different catheters, removing pancreatic cancer, definitely removing breast cancer, colon cancer, doing Whipple procedure, gallbladders. He was one of the first to be doing gallbladders with robotic surgery. And so if anybody ever asked him his experience, you just need to go ahead and get you a pillow and go to sleep, because that list is going to go on and on and on. But it matters. It does matter, right? The experience.
Absolutely. Remember, Ms. Rosalind, she says, what medication are you using would be her question.
Okay, yeah. So and I think about it, when you're going on anesthesia, okay, I'm going to count back from 10. You're going to go to sleep. But unless you ask, or unless it's someone who's really forthcoming, oftentimes you don't know. Is it propofol? Is it this? Is it that? And assuming that the medicine's not mislabeled, you do have the right to say, excuse me, can I please be a part of the double checking and the crossing, just to be sure I'm getting the right medication? No disrespect to you. I just want to advocate for myself and protect my safety from human error. You do have the right to ask that. Yes, you do have the right. Good.
And Nick, along with it, she says, what is it for? Some nurses don't know, but they should know enough to tell you and double check.
Now the nurses should know. So I'm with you. So when they come into a hospital, even with pills, okay, you got to take these pills. What am I taking? Oh, it's carvedilol. Why am I taking that? Oh, it's atorvastatin. Why am I taking that? Oh, it's Lexapro, Prozac. Why am I taking? Yes, ask. And if they don't know, it's okay to say, well, can you, before I take it, can you please come back once you know? Because that's also a check to the nurse, and it can tell you a lot. Yes, nurses should know what they're giving you and why. They don't have to give you the whole dissertation, but at very least, they should know what it's for. Good.
Yes.
All right. So I really pray for the well-being of her and the other victims. I just don't know what to say. There's no correction for that. I pray that they help her in any way they can, to at least for her family, her loved ones, for her to have the best possible rest of her life. And I pray that she's able to somehow turn this tragedy into a triumph. That's hard. Yeah. I'm sorry that happened to her. And I hope it's a lesson to doctors, distributors, whomever, to continue being very, very serious about the checks. All right. Y'all, please go ahead and give us a like, give us a subscribe. We're doing a whole lot of talking, group talk. But if you would like to talk to me one-on-one, I do offer a concierge service. I can help you from anywhere in the world. You come on telehealth. I take a full history, and I mentioned the different certifications I've had: nephrology, internal medicine, pediatrics, obesity medicine. I love to share. I read medical journals every single day. I've been able to help a lot of people with this service. I'm very excited about it. So click the link in the description or go to my one-stop shop, drfrita.com, for a telehealth appointment. And then if you don't mind sharing your information in front of other people, again, for the membership at the highest tier, we have the live Q&As. Plus I give you members only videos, members shout outs. So make sure you join the membership if you haven't already. All right.
Dr. Frita,
did y'all watch 5?
Yeah, speaking of member shout outs, Mr. Randy is in with us today.
Hi there, Mr. Randy. How you doing?
And Peace Oasis. Hello.
Hi, Peace Oasis. Thank you.
All right. And wonderful. To Deborah, she asked, how do we become a member? So, Miss Deborah, on any Dr. Frita video on her YouTube channel, next to subscribe, use the button to say join. Select your tier, and welcome to the membership.
Please join. All right. And so, y'all, the 5 heartbeats. The 5 heartbeats, one of the stars, Michael Wright, has passed away at the age of 70. And he passed away with a rare neurological condition, as well as heart disease. And The condition that he had is one that caused the lining of the corpus callosum, the portion of the brain that connects the hemispheres, the right side to the left side. There was a wearing of that. And I don't know why his had the wearing or the degeneration, but a common reason for this particular condition that he had is from alcohol overuse or even from vitamin deficiency, specifically vitamin B vitamins like thiamine. In addition, he also had a heart condition, which just adds to the complexity, but he was 70 years old. As far as the condition, oh my gosh, it's a Markia fava bigamy. And we can put that up. And if you Google Michael Wright, you'll see what it was. As far as that neurological condition, the mainstay of treatment was if there was alcohol overuse, to stop drinking the alcohol or get help with that. Again, I don't know if that's the reason that he had his. That's just a common cause of that particular brain condition. It can cause one to have abnormal balance, ataxia, like walking with a wide base gait, confusion, seizures, memory issues. And so it's pretty rare, but that is what reportedly he had. And again, heart disease in addition. And we know that heart disease is the number one cause of passing away. But that the 5 heartbeats is a classic. And if you talk to someone who's a real one, they'll probably be able to quote the movie in and out. So he was very well known for that. But again, prayers going up, in order to support his family and to his fans. And I pray that he passed peacefully. But if you are dealing with someone who is having certain symptoms like the ones I described, be it confusion, make sure that they're seen by their primary care doctor and certainly by a neurologist to make sure that they're not dealing with something that can be treated or managed. Okay, so just don't ignore, please, when people are having neurological symptoms, even if it's you. Yeah. All right. Well, I like to play a game at this point in my life. And the game I like to play is myth versus fact. Earth, Wind, and Fire, the drummer from Earth, Wind, and Fire, John Paris, actually sadly had a cardiac event. And afterwards, they cooled his body temperature. They made his body really, really, really cold as a part of the treatment. So let's actually, if we have a video, let's go ahead and play the video, and then let's play myth versus fact as we try to learn and pray. He's only 58. Let's really try to pray. Let's pray for his well-being and well wishes for him and his family.
He talked about how Lionel Richie and Earth, Wind, and Fire had to cancel their concert on August 6th at San Francisco's Chase Center. At that time, we didn't know exactly what was going on. We were only notified that a band member of Earth, Wind, and Fire suffered a medical emergency. Well, evidently, we now know that that band member was their drummer, John Paris, and he was taken to the hospital because of a cardiac emergency. Sounds like probably a heart attack. Evidently, he was put into an induced coma when he arrived at the hospital, and after an undisclosed amount of days, he came out of that coma very briefly, and friends and family said it was the old John back for a moment. But within a short time, his blood pressure started to climb even further, and they induced yet another coma. Friends and family have put together a GoFundMe. It's raised up to $60,000, which makes me wonder why a successful act like Earth, Wind, and Fire couldn't help out. Maybe they are, maybe the costs are just a little too much to incur, even for the band.
That was a loaded video. So we got that information that the young drummer, 58-year-old, had a heart condition. So to my knowledge, we don't know if it was cardiac arrest. We don't know if it was heart attack. And we're going to talk about the difference between cardiac arrest and heart attack. But that was a question to be asked. Why does he not have money? Well, I'll tell you, if you talk to different band members, health insurance is not necessarily something that's guaranteed, right? And even if they have money, to be on the go, are you guaranteed to have an extra $250,000 just sitting around if you don't have health insurance? Not necessarily. So that's a whole nother conversation. But let's go ahead and play myth versus fact, and we'll learn some more about him and that induced coma and the specific therapy they used, because they put him, they made his body very cold as part of the therapy.
All right. Statement 1. During a medically induced coma after a cardiac arrest, doctors often intentionally lower the patient's body temperature.
Okay. M1, if that's a myth. F1, if that's a fact. Do they intentionally lower the body temperature after an event like a cardiac arrest? M1, if that's a myth. F1, if that's a fact, that it's intentional that they lower the body temperature after a cardiac arrest. All right, number 2.
A sudden cardiac arrest and a traditional heart attack are two entirely different medical conditions.
Okay. Are they different? Because a lot of people use them interchangeably. So M2, if that's a myth. F2, if that's a fact. Sudden cardiac arrest and heart attack are entirely different. M2, if that's a myth. F2, if that's a fact. Pencils down, pencils down. All right, medheads, are y'all there? Are you there? Somewhere out there.
All right, Dr.
I didn't give
Freeman.
y'all much time. Y'all didn't need a lot of time. All right, what we got, Shador?
All right. During a medically induced coma after a cardiac arrest, doctors often intentionally lower the patient's body temperature.
And I'm curious about this one.
Member Ms. Sheila says it is a fact.
All right, Miss Sheila.
The flower lady, hi, says myth.
A myth, okay.
Yolanda says it is a fact.
All right, hi, Yolanda.
Simone, hello, says
Hi,
fact.
Simone. A fact.
Just anticipate, agrees, it's a fact.
All right.
Andre, hello,
Hi, Andre.
says a myth.
A myth. Like, why would you intentionally lower someone's temperature? Okay.
Eunice says fact.
Hi, Eunice.
Marina says a myth.
You think it's a myth?
Raven agrees it's a myth.
A myth. Oh, I love a
And
mixed bag.
members Miss Ebony
Hi.
and Grace both say fact.
Thank y'all for being members. All right. A mixed bag. We literally just about had 50-50. Okay, that's really good. Okay, read that again for me, Shador, and let's break it on down to the ground.
All right. During a medically induced coma after a cardiac arrest, doctors often intentionally lower the patient's body temperature.
This is a fact. It's a fact. Doesn't that seem bananas? I remember when these protocols were first being introduced during my training, actually. But there is something called targeted temperature therapy where we intentionally lower the body temperature after a cardiac arrest, and I'll explain why. So when I say lower the temperature, I mean lower the temperature. You know that normal body temperature is, around 98.6. We lower the temperature Fahrenheit, 98.6 Fahrenheit. We lower the temperature to as low as 88 degrees Fahrenheit. Or if you think about it in Celsius, we'll lower it to between 31 and 34 degrees Celsius. So freezing cold. And we can do it either with putting cold compression, cold packs on the body. We can also run cold IV fluids, but it is intentional to get the body temperature low. And this is why. After a cardiac arrest, there is an increased chance of inflammation in the body, fevers, swelling of the brain. By lowering the body temperature so extremely, that helps to prevent cerebral edema or brain swelling. It also slows down the metabolism, right? It slows down the metabolism, and it can decrease how much energy is needed for the brain to function, and the body for that matter. It can also help to decrease inflammation in the body. It reduces or really knocks out the risk of having fevers. And we know that fevers can be very detrimental to the brain and the body after a cardiac arrest. And so for at least those first 24 hours, it's been shown by multiple clinical trials that it can really help as far as the survival after a cardiac arrest. And so That is a fact. It is intentional to do that targeted temperature therapy and to lower that body temperature from what should be a 98.6 in a normal human being to as low as 88 degrees Fahrenheit. So pretty extreme. But yeah, it's been shown to improve survival. And we'll talk some more about John Paris because I have not seen what his exact cardiac event was. But let's talk about this next myth versus fact question, then we'll get into it. Thank y'all, med heads.
All right. Statement 2. A sudden cardiac arrest and a traditional heart attack are two entirely different medical conditions.
Know what y'all say.
All right. We got Benita. Hello.
Hi, Anita.
She says a fact.
A fact. You think they're different. Okay. But
Miss
Anita, don't you
Eu-
hear people using these things interchangeably? I do. Okay.
Yeah, I do
All
too.
right.
Miss Eunice says a myth.
A myth. Okay. You think they're the same thing. Whether it's a sudden cardiac arrest or a heart attack, it's a bad idea. So you think it's the same thing. Okay.
D. Dean says a myth.
A myth. So you think they are the same thing. Okay.
Miss Sheila says a fact.
Miss Sheila, why you be on here with your knowledge? Knowledge is power. So even though they're used interchangeably, you agree with Anita that they're different. Sudden cardiac arrest versus heart attack. I see you, Miss Sheila.
Ebony says a fact as well.
All right. All right.
Shout
Miss
out to
Ebony.
member Miss Andrea says a fact.
Good
Hey.
one. Okay. You think they're different? Okay.
Barbara says a myth. Fact. I'm sorry.
A fa-
Hi, Barbara.
Barbara says it's a fact. Oh, that's my auntie's name. Okay. So you think it's a fact. All right.
Shirley, she says a myth.
You think it's a myth. You're not buying it. Heart attack, cardiac arrest. Yeah. Well, I can't wait to talk about this. Okay.
2 more. Member DeCala says a myth.
All right, Dakala.
And Miss Khadija, hey.
Hey,
says
Khadija. Are you okay? She activated. Okay.
She activated in a minute. She says a fact.
A fact.
Yep. And
All
Peace
right.
Oasis agrees. It's a
Peace
fact.
Oasis also says it's a fact.
Mm-hmm.
All right. Well, guess what? It is a fact. Sudden cardiac arrest is different from a heart attack. And I will say, look, I just want to talk about this because I get a lot of questions about it. And like I did a video, and again, once you finish watching this live, you can check it out on different platforms. Follow me on all platforms at Dr.Frita, because when people found out that Hayden Panettiere had a cardiac arrest, they're like, oh, she had a heart attack? I'm like, no, that's not what that says. You know, it's not necessarily so. So cardiac arrest, heart attack, two different things. Here's where the confusion comes in. Are y'all ready? A heart attack can lead you to having cardiac arrest. That is true. But you can have a heart attack and not have cardiac arrest, just like you can have cardiac arrest and not have a heart attack. Confusing? Okay, let's unconfuse it, even though I don't think that's a word. A heart attack refers to a decrease in blood flow. Okay, so if there's a blockage in your heart artery, like from a plaque or from atherosclerosis, or even like a spasm or a narrowing of the heart artery, there's an issue with the plumbing and you're not getting the proper blood flow to the heart muscle, and so the heart muscle passes away. There's a heart attack, myocardial infarction. Okay, a problem with blood flow. With cardiac arrest, it's an electrical problem. Okay, there's something that's gone awry with the electricity in the heart to cause it to stop pumping or to pump in such an abnormal way, in arrhythmia, that then the heart stops. So that's a cardiac arrest. So I said that a heart attack, you can have a heart attack where the blood flow causes heart muscle to pass away, and that can lead to an electrical problem, cardiac arrest. But they're two different things, because you can have a cardiac arrest and have super clear, super clean heart arteries. So let's just talk about a couple of more differences. Warning signs and symptoms. So I have a lot of videos on that here. Make sure you check out my 7 heart attack warning signs and symptoms you don't want to miss. Also, I did a more recent one for women where I talk about heart attack warning signs that most women dismiss as stress. Check that out. But bottom line, for a heart attack, you oftentimes do have warning, be it chest pain, be it sweating, be it nausea, be it jaw pain. You have a warning usually with the heart attack, where you can have someone, call 911, or like you think about Sanford and Son, he was always grabbing his chest, telling me he was having a heart attack. But you usually have some type of a warning, and you might even be able to call 911 yourself. That's the kind of warning you get with the heart attack. Cardiac arrest, you don't get a warning, you just drop. Okay. Sudden arrhythmia, or the heart just stops and that's it. Okay. So you don't get the same warnings for a cardiac arrest. And the other thing, there are different causes for heart attacks. Typically you're going to talk about, it's heart disease, cholesterol, atherosclerosis, plaques, whatever process is causing you to have a blockage of blood flow in the heart attack. Whereas cardiac arrest, again, you could have totally clean coronary arteries. And here are some of the causes of cardiac arrest. It could be from having abnormal electrolytes. Like if you have high potassium, hyperkalemia, that can cause you to go into cardiac arrest. If you have abnormal heart rhythms, atrial fibrillation, ventricular fibrillation, you can go into cardiac arrest from there. Congestive heart failure, especially if you have a low ejection fraction, your heart's not pumping very well, you can go into cardiac arrest. If you have cardiomyopathy, and interestingly, something called dilated cardiomyopathy, you can get it from certain chemotherapies like adriamycin. You can get it from alcohol overuse, can lead to dilated cardiomyopathy as well. Even certain viral infections, Coxsackie virus can do it. Congenital heart diseases like idiopathic hypertrophic cardiomyopathy. And you know what else can cause cardiac arrest? If you have respiratory arrest and stop breathing, that can lead to it. And also overdose. Drug overdose. Again, we don't know the cause and manner of death for Hayden Panettiere, but for people who do have drug overdose, then be it with opioids, benzodiazepines, having an overdose can lead to cardiac arrest, even if you have clean heart arteries. So yes, they are two different things. Heart attack is with the plumbing of the heart, and the cardiac arrest is with the electrical activity. I do have a video right here on the Dr. Frita YouTube channel, cardiac arrest versus heart attack. So after we finish this live, if you want to kind of go back, it's about an 11-minute video where I go into detail about cardiac arrest versus heart attack. I'm telling y'all, I have hundreds of videos here. Please make sure you give us a like, give us a subscribe, hit the notifications. That way you'll know when I pop up and do surprise lives. And also you'll be among the first to know when I release new videos, whether it's my media appearances or me giving you new information. I'm giving you a new video this week. Do I want to tell you what it is? It's a good one. I'll say that. Just stay tuned, y'all. Put the notification bell on. Also, make sure you join the membership. We're going to do our members only live Q&A. I'm going to give y'all a members only video today or tomorrow and just tell y'all some of the things that are going on. Please make sure you check out my book, Under Pressure, A Guide to Controlling High Blood Pressure. I'm very excited because it is an Audible now with my own voice, a labor of love. Oh, labor of love. And I talk to you not only about traditional ways of managing blood pressure, but also natural, holistic ways. And so you can be walking the dog, doing your laundry, cleaning the kitchen, just doing whatever, and you can listen instead of having to read. So please check out the book in Audible. If you have an Audible membership, use one of your credits to get it. You can go to Amazon to get it. And again, drfrita.com. That's my one-stop shop. The television appearances, I told you you can go to the TV playlist. Just last week, when I was on 11 Live NBC with Aisha Howard, talking about more of these food recalls. And listen, there are even more. Just y'all stay tuned, put the notifications on. I'm going to come back up here to talk more about food recalls. I'll do that in a live sometime this week. At any rate, I really appreciate y'all for being here. Thank you for all of your participation. Please be sure to give us a like before you leave and share the link of this video. Even for folks who are somewhere working their 9 to 5 and they couldn't make it to this live, they will still benefit from the information, not only from this live, but from the hundreds of videos that we have. We covered a lot of information today. And just always, again, be on the lookout. Follow me on all social media platforms, because I'll probably go on and do more short form content just to highlight some of the medical information that we talked about. All right. As usual, I appreciate you. I appreciate my co-host, Miss Shador, from doing a phenomenal job as usual. Appreciate y'all for being here on Dr. Frita Live as we talked about the latest trending medical headlines and celebrity health news. And I appreciate you for making Monday your healthiest day of the week.